Hi, I'm Carrie Britton. I will be doing my presentation over electronic health records. So just some quick background information. Governments throughout the world have been reevaluating their healthcare systems and have been revamping them. Within the last 20 years, within our own country, this has become a main topic of focus. And there's been a rapid expansion of technology within the healthcare information technology arena. And this was in part driven by the passage of the Health Information Technology for Economic and Clinical Health Act, or HITECH. So the HITECH Act was passed in 2009 as part of the American Recovery and Reinvestment Act, and its goal was to modernize the American healthcare record system. So basically, some of the goals included providing enhanced patient safety measures as well as making records more portable for patients as well. It also provided incentives meant to encourage the meaningful use of electronic health records. I'll be talking a little bit later on in my presentation about what meaningful use means. So electronic health records are a computerized version of a patient's medical chart, and it'll contain data such as patient demographics, current medications, diagnostics, medical notes, emergency contacts for the patient, as well as known allergies. There's two different types of systems that are used. The first is a physician-hosted system. With this system, pretty much the physician owns the server where all the data is stored, and he or she is also responsible for all the equipment used, system maintenance, data backup, and security. There is a concern that potentially a software vendor could hold patient information hostage if a dispute were to occur about price. The other option is what's called a remote hosted system. This is where all the data is stored on a third-party server. The physician does not hold any control over the data. And as such, the third party is responsible for all equipment, system maintenance, data backup, and security. So pretty much it's kind of a store and go. They don't have to really worry about the technical aspects of the data itself. That's somebody else's responsibility. Within remote hosted systems, there's three options. The first is a subsidized remote system. And this is a third-party server who typically has a relationship with the physician. And typically this is like a hospital-physician relationship. One of the concerns that have been expressed within the medical community is what happens when the physician stops working for that hospital and chooses to leave? What happens to that patient's data? Say the physician decides to open up an additional practice outside of the hospital system. Does that mean that the patient's information is entirely lost after that point? There's also a dedicated host remote system, which is where all the data is stored on a vendor server. And then the third option is a cloud-based system where the data is stored on an internet site. So really and truly, since the inception of this technology, one of the main concerns has been the ability for different software platforms to communicate with one another, because each facility has their own unique needs. The question of having those records be able to communicate back and forth so its true portability has been raised. And a solution to this has been the introduction of free open source software. And basically what it does is it gives the provider the right to run, copy, distribute, and change the software to fit their unique needs. It also comes with a large community of developers, which allows for this free exchange of programming. So this was one of the main software engineering programs basically that allowed the proclivity of the internet to happen, because it faced a lot of the same concerns that electronic health records are now facing. So a lot of folks believe that this free open source software, or FOSS as it's become known, is really the key to the rapid diffusion of this technology. It also enhances security through the use of highly visible coding, since traditional software, pretty much any security concerns, the IT team is only made aware of when the software distributor decides to pass that information along. So this method helps out with the security of patient data, which is also a major concern. Healthcare providers are under strict HIPAA guidelines, or they can, any violation results in massive fines. So the good news is with having electronic record, typically they make use of encryption data, meaning that not just anybody is able to view the patient's record. Also, there's usually significant passwords and logins. So that's really different and provides more security than a traditional paper chart, where if somebody leaves the patient's chart just lying around, anybody can walk by and instantly know anything there is to know about that patient's medical history. Good news is also it leaves a footprint for auditing. So if there's ever concern about a data breach, the IT team is immediately able to determine who accessed the record from what location, what patient's account, what information was noticed. So it's a little bit more enhanced than a traditional paper chart would be. There are many benefits. The first is to the patient. Certainly convenience is a huge consideration for patients. We live in a really fast-paced world, so patients want access to their medical records now. They don't want to wait to go drive down to their provider's office to pick up a chart. They want access immediately. They can also access the provider. Many patient portals have a place where a patient can actually directly ask questions, raise questions about billing, or even just note errors within their own chart. It also eliminates redundant paperwork for the patient to fill out. So I can remember as a little girl going in to the doctor's office with my mom and us having to sit there every visit, spending out, it felt like 15 minutes of paperwork over and over and over. And with these systems, literally the front office can check the patient in, verify the information is correct. If anything needs to be changed, they can update that immediately, and the patient can move on to the next stop. It also saves time waiting for prescriptions to be filled. So many of these systems have an e-prescribing system where the doctor can actually order the medication in real time, and it can be sent immediately to the pharmacy of the patient's choice. So it really does eliminate that long wait time. And there was a study that was performed by the Office of the National Coordination of Health Information Technology, which showed that 92% of patients surveyed were happy with e-prescribing, and 90% also said that they rarely had to wait for their prescription to be filled. So it really does make the convenience factor a reality for patients, and which ultimately increases compliance for medications. There's also provider benefits. The first is it improves coordination of care for patients with chronic diseases. So patients with chronic diseases typically see multiple providers in multiple facilities. So by having access, universal access to the same patient's record, and it's complete, up to date, and accurate, providers are able to provide exactly the care that the patient needs. They're not repeating tests that have already been performed. They can see what those test results were, what the last physician took care of. It just helps to enhance this coordination, gets everybody in on the same goal. It also increases the quality of care provided through decision-making support systems. So a study performed by the New York Presbyterian Hospital in conjunction with Weill Cornell Medical Center, the study was published in 2012 in Science Daily, and it showed that 56% of physicians interviewed who use an EHR, or electronic health record system, showed a dramatic increase in the quality of care provided versus their paper charting colleagues. And this was based on 4 metrics such as hemoglobin, A1C testing for diabetics, as well as breast cancer screening. And so the belief is that because these reminders, for lack of a better word, pop up, physicians aren't letting routine testing, routine checks fall through the cracks. It also has shown a reduction in medical errors. The same study showed a 63% reduction of all medical errors. And part of the belief is that because nothing's handwritten, everything is very complete, concise, easy to read. There's also benefits in the public health arena that I think a lot of folks overlook. So it does provide a unique opportunity for disease surveillance. So prior to the invention of this technology, public health officials were really reliant on telephone surveys. And those were really limiting because it was reliant on the patient giving accurate statements as well as being willing to participate. So sometimes that data could be very skewed. With electronic records in use, they're able to provide or to pull information from a very broad range of patient population, and that information is complete with diagnosis as well as treatments and which physicians are diagnosing patients and taking care of patients. And it also provides real-time information which can be invaluable for potential public health threats. So, flu season, it's on us. That's all we've seen on the news is the flu epidemic, and that helps health officials monitor its progress. Also, in our post 9/11 world, unfortunately, a biological warfare is a reality for a potential threat. And so, again, with this real-time information, public health officials are able to identify and potentially isolate populations if needed. Cost is a huge concern, and it can be a bit of a barrier, especially for small practices. So, in a March 2011 study published in Health Affairs, which followed the cost of implementation among 24 primary health care practices, the study showed that the average cost was $162,000. There was an additional $85,500 cost in the first year in maintenance cost. So it can be expensive, absolutely. It also took about 611 hours for the implementation team to actually prepare and launch the system, and 134 hours were spent in staff training. So, that can be quite prohibitive, again, especially for small practices, because not only do they have the cost of the software itself as well as the equipment that's needed for it, but there's also the risk of potential overtime as well. There was a study I read that indicated, practices can expect a 50% reduction in revenue the first year that they implement an electronic health record system just because the staff has to get used to using it. Thankfully, the Center for Medicare Services, Medicare and Medicaid Services, or CMS, actually has created some new incentives, which is meant to encourage the diffusion of the technology. In order to receive these incentives, or bonuses, if you will, the provider has to achieve what's called meaningful use. And this is according to pre-established core and menu criteria. And the criteria includes the provision of data capture and sharing, inclusion of advanced clinical processes, and improved patient outcomes. And honestly, the compensations can be quite substantial. So for what are called eligible professionals, it can be $44,000, and for hospitals, it can be $2 million or more. So that really cuts into the previous slide, which talked about the cost not only of software and equipment, but also for potential overtime for staff training. So again, implementation can be difficult, and as we all know, transitions can be hard. The Office of the National Coordination of Health Information Technology put together a 6-stage process to help make the implementation process as smooth as possible for administrators. The first stage is to assess business readiness. So pretty much what this means is determining what equipment do we have, what equipment do we need, what is the baseline computer literacy of the group who's going to be using this, do we need to change, enhance that. That's pretty much what the first stage is for. Stage 2 is planning your approach. So this is where the administrative team should actually be planning a timeline, setting goals, setting objectives. What do they want to achieve for the implementation? That's what the plan your approach. Also, somebody should be appointed to actually oversee the project. Stage 3 is actually selecting an electronic health record, and it's got to meet the needs for the facility itself. It can't be just a willy-nilly, hodgepodge pick of, what they think is, or what's the cheapest version. It really has to meet what the goals established in stage 2 were. Stage 4 is where staff are actually trained in the technology and everything's launched. That's usually the hardest part, is stage 4, because That's where surprises happen, and that can be the longest part. Stage 5 is where those meaningful use objectives should be achieved, and that's, again, part of what the administrative team is going to help kind of check in on. And stage 6 is continued quality improvements. So basically, this is kind of a follow-up of, did we meet our goals? Did we meet our objectives? What worked? What didn't? And what can be done to improve the system as it is. So I put this last slide in here. It's a little quote that just says, change is hard at first, messy in the middle, and gorgeous at the end. Because I really think that this speaks to change in all frontiers, but especially in the realm of healthcare and health, information technology. Because, within the medical community, change is the norm. And it can be scary, especially for more traditional providers, to go from the safe paper chart to, an electronic version. And so there's a lot, when these systems are put into place. I actually worked for a hospital that we made that transition, and yeah, it was difficult. It was incredibly difficult. The first year and a half, lots of surprises, lots of pulling together had to happen. But the end result was a smoother system that really did help prevent medical errors and made sure that we all had access to the same information. It didn't matter who had such and such as chart. It really did increase the efficiency. So I hope that provided a little bit more insight into electronic health records. Thank you so much.